When lifting an object, the position of the spine and your posture can greatly affect the likelihood of an injury. Here we see there's no consideration of the load to be moved. Notice the straight legs and how the lower back muscles are doing the work to lift the load. During the lift, the weight of the load and the distance it is away from our body is the biggest risk of damage to the lower back. There are movements that can also have an impact on the risk of injury. Bending from the waist will influence the chance of damage. The number of times we do this per hour will also increase the risk. Twisting. Here we see the shoulders move from side to side out of line with the hips. Again, the speed of this movement will increase the risk. Holding the load away from our spine, the greater the distance, the greater the risk. With lateral movements, we see the spine move from side to side, shoulders in line with the hips, similar to when we pick up a suitcase. How do we lift safely? Stop and think. Can we avoid the lift, or could we use a mechanical aid? Where are we moving the load to? Are there any handles? Where is the centre of gravity? Is it sharp? Look at the stance. The legs are in a stronger position, one foot slightly in front of the other, with the load accessible between the feet. Assess the load by picking up one side. Is it what you expect in terms of weight and balance? Remember, only pick up what you feel comfortable with. When lifting, use the big muscles in the legs and arms, moving the load close to the body. Pick up in a smooth motion, looking ahead. It's important not to flex your back while lifting. When putting the object down, we follow the same principles. Smooth movement, letting the big muscles do the work. Moving a load to a high shelf. We should face the shelf with our feet in a strong position. Remember, use the legs and the momentum of the load to assist the lift. Where possible, use the shelf to take the weight of the load to avoid overreaching and strain to the back.